Assalamualaikum warahmatullahi wabarakatuh. Good day everyone. We are the second group and for the fellow members there are Nur Anissa Indah, Akila Nadifa, Naili Najah, and Akif Ibni. And the last member, my name is Aldil Fitrani and I'll be the moderator for this session. I'd like to welcome you to today's case report presentation, which is an important part of our campus assignment. We are going to share about case report with title Simultaneous or for Bilateral Comminuted Proximal Humerus Fractures. This presentation will be divided into 5 parts, and there are abstract, introduction, case presentation, discussion, and conclusion. For the abstract will be explained by me, the introduction will be explained by Indah, case presentation by Akila, discussion by Naili, and for the conclusion will be delivered by Akif. First, abstract. Bilateral proximal humerus fractures are rather rare, if at all they occur due to high energetic traumas in young patients and elderly patients due to low energetic traumas who have osteoporosis. This case study report presents the case of an 80 years old female with bilateral proximal humerus fractures who had a history of hypothyroidism. Therefore, ORIF is the treatment of choice for such fractures. This case is interesting because it rarely occurs in elderly female patients.
I explain about introduction. Around 5 to 8% of fracture cases include proximal humerus fracture. Bilateral proximal humerus fracture are rare. In most cases, proximal humerus fracture are surgical threat. We present a case of an elderly woman who sustained trauma was out to wound her shoulders, found to have simultaneous bilateral comminuted proximal humerus fracture.
And now I will going to give presentation about case study which we have already discussed. The first, this is the case on physical examination, was found to have decreased and painful bilateral shoulder ROM with intact proximal and distal neurovascular structure. Patients suffered from bilateral proximal humerus fracture were treated with open reduction and internal fixation. In the next slide, this is a picture of X-ray radiograph, the left shoulder showing comminuted proximal humerus fracture, and beside this is picture of CT scan with 3D reconstruction of the left shoulder showing the fracture of the humeral neck. And the next slide, this is picture show X-ray radiograph of the right shoulder showing a comminuted proximal humerus fracture.
I'll explain about the discussion. The frequency of proximal humerus fractures increases as average life expectancy increases. People who suffer from osteoporosis have a higher risk of experiencing bone fractures. About 5% of all extremity fractures are fractures of the proximal end of the humerus for people under 40 years of age and 76 for people over 40 years of age. Additionally, women are 3 times more at risk than men too. Open reduction and internal fixation. Open reduction and internal fixation is the most popular treatment for the type of fractures. Post-operative X-ray radiographer of the left shoulder showing code element post-arrive of the proximal humerus fracture using N10 second and post-operative X-ray radiographer of the right shoulder showing wood element post-arrive of the proximal humerus fracture using flat N10 second.
Okay, I'll explain about the conclusion. Proximal humerus fractures are common and there is still debate regarding the best treatment. Modality depending on the patient age. Bilateral proximal humerus fracture are extremely rare with direct trauma to both shoulder simultaneously as the mechanism of action. In some cases, it is important to prepare hemiarthroplasty, prosthesis, and reverse shoulder prosthesis as a backup in case of open and internal fixation due to a fracture that cannot reduced by good bone stock. Thank you.
In closing, I want to express our appreciation for the attention to our group. We hope you found the insights and information valuable. Thank you again for being a part of today's event. Wassalamualaikum warahmatullahi wabarakatuh.